I'm Dr. April Moreno, and I got started in podcasting about 2 years ago, actually. And so my background is in public health. I have a doctorate in health promotion sciences and information systems. And basically, it's just this long story where I was diagnosed with an autoimmune condition. And from there, decided to find creative ways to share that experience and reach out to people. So that's how the first podcast began, the Sisterhood of Limitless Living. So that podcast is dedicated to autoimmune women thriving. It's a multicultural podcast. So that's one that we definitely have. And it's in our second year now, as of this month. And then I started podcasting in a couple other podcasts as well, which I'll talk about, if time allows.
For sure. And I guess I actually want to say I'm super excited to talk to you because one of the first podcasts I ever helped produce was a nursing and U.S. public health podcast. So I know a little bit about that podcast realm. It's super cool. I guess so. Is that where your passions kind of overlapped? It was kind of wanting to talk to people about your own experience.
So I think people podcast for different reasons.
Yes.
Some people are podcasting because they really want to get involved in like production and in maybe journalism, different ways of working with podcasts. And so for me, podcasting was a way of a couple of things, I guess. Starting my own business outside of academia. So I finished my doctorate, did 2 years of a postdoc, and then from there just didn't quite get the funding and the job that I was seeking as a professor. And so from
Right.
there, just decided to go ahead and get creative. How can I use podcasting to reach more people and to help people
Oh,
with
amazing.
autoimmune conditions? So yeah, it started out basically for healthcare purposes, and I would even say more so public health purposes even.
Nice. So for those of you that are just tuning in, just this is our weekly WC Podcasters live series. If you want to join our community, you can head over to wocpodcasters.co/community. And I'm actually really excited too that we're talking because you have something really new coming up, your public health podcast network. That's super new. Do you want to tell me a little bit more about it, how it got started?
Definitely. So just thinking about ways to help people. Oh wow, it's kind of broader than I'm even saying. I'm starting at a different place. I think it really also stems from the new emphasis, thankfully, of like social justice and racial equity
Right,
that's out there.
right,
And in public health, there still remains a huge need for health equity, diversity, implementation, representation of public health, even within organizations. And so, what I wanted to do with the Public Health Podcast Network was connect more people and to build diversity and to
mm,
build health equity through podcasting. So, we're using podcasting and the word network for professional development. We're using it as a professional network, and we're using it to build more infrastructure for people to learn how to podcast, to voice the needs of health equity out there for social, cultural, environmental, and global health.
nice. So that kind of leads into my other question, next question, which was, so who can sign up to be a part of the network? Is it other podcasters? Is it people wanting to listen to public health podcasts?
Yeah, so been working on that strategy at the moment. It's still very new. This idea actually literally began in March. And so basically what I'm looking at is a way to reach out to students, professionals in public health, and podcasters, as well as universities who run these public health programs. So it's
Right.
this kind of infrastructure of people who are in this pipeline of learning about public health and how it can build health equity, how we can improve the environment and make the world a better place, literally.
Right. And I guess with that, hearing about this is very exciting, but what are your kind of big goals and hopes for this network?
The big goals for this network are, the first step is to have the directory of public health podcasts. So this is community health, global health, and environmental health podcasters. This is the individual This is the university and the agency. Like, let's say, I think, big organizations also have public health podcasts these days. I'm not sure if the CDC has one, but at that level, there are different podcasters as well. So connecting all of us. So having a directory of where people, if they want to learn about public health, where can they go to learn, to hear about different podcasts and hear different news and information that's trustworthy even during the pandemic. And then from there, having a membership, very similar. I love what Women of Color Podcasters is doing, and working on building up a membership model as well for this podcasters membership that would include talks. It would include webinars and professional talks about career development and even podcasting for public health. So we're looking a lot at health communication through public health and career development through this membership model. I've also been doing some paid university talks on the power of podcasting for health equity, the power of a public health podcast network. And then I think finally, one of our longer term goals is to build a summer health equity podcasting institute for people who are dedicated to health equity, dedicated to their communities. How can they learn how to podcast and share the important message? Because you don't have to have an MPH to do public health. You can, just be someone in a community and serve to improve health outcomes for the people that you care about.
For sure. When you talk about network and the fact that we're also a network, I guess I think to be a great person to ask, from network to network, why do you think people, one, should join a network, and two, what are some tips maybe to get the most out of joining like a community of fellow podcasters?
Yeah, it's important to have a network just in terms of like, social connection and even learning how to improve a podcast. I learned how to podcast through another Facebook group for women, right? Who podcast, she podcasts, and I learned from zero. Everything was through that network, and then building career possibilities and just all of it. The power of who you know and
Yes.
what you know can be multiplied through a network like this.
Oh, for sure. For sure. I'm excited. I'm excited to see this come together. And also this makes me think of, as you know, like with different types of like different podcasting genres, maybe niches, there's that question of like when you're, doing a podcast for public health, maybe this is something that came up in your podcast or in the network you're building. The content that you make, is it for people who are like outside of that? And let's say like maybe about living with an autoimmune disease, or is it for the autoimmune disease, or is it for the people that are already in the community that kind of want to hear someone else from inside be like, hey, I see that too, I notice that too, hey, this funny problem happens with me too. For you, where do you like to sit in all of that?
Yes, so I think the three podcasts that I have are for different audiences. So for example, the Sisterhood of Limitless Living is particular to women who are living with autoimmune conditions. So it's a way for us to connect. This is the place that gives me strength and gives me life as well, living with my own autoimmune condition, meeting other people who have really found a way to think beyond that condition, about who they are, that their disease is not going to identify them, but it is something that we navigate. How can we proactively and creatively build our lives in a limitless way to do all the things we want to do, regardless? We may have to carry this disease on our back, but how do we get through and still manage to do all the things we wanted to do? So with that particular podcast, it is for people, and particularly women, multicultural women living with autoimmune conditions. And then my other podcast is on COVID. I do one on public health policy and culture for COVID. And that one is for everybody. It's just
Right.
sharing the message about the importance of this current moment and how we can learn how to stop the next pandemic. How do we survive? How do we equitably get the vaccine out and help the world overcome this pandemic? and we share, information, interviews with scientists, researchers, technologists, people who are literally on the front lines helping to get people their appointments around the clock. There's the Vaccine Ferry, for example, which I love so much. They are a nonprofit that just helps people get their vaccine anywhere in the country. And they work around the clock to click on that website until that opening is available. And then my third podcast is on healthcare strategy and culture, where I'm working with healthcare organizations and nonprofits, how they can build their motivation, employee motivation, productivity, and build their strategic plan.
Nice. I guess like with that, because you've done now, okay, so now we've got a network, 3 podcasts. What are some of the big like takeaways you've learned, like, maybe something you didn't expect when you started, and now you're like, oh, I know this. What's something that maybe comes to mind for you?
I didn't realize how much I would love podcasting. I think it's so, the opportunities to network and meet new people through podcasting has been amazing. I love it. I love the whole process of getting a chance to just reach out and interview people. I love the opportunity to hear their story, share their story, even learning the whole technique of editing and all that background stuff. And then even, designing the images and the show notes, sharing their stories through words and voice. It's just been a lot more rewarding than I thought it would be.
Oh, that's lovely. I find that as well, being able to talk to, just like pick people's brains. And I think it's also like, especially with the kind of stuff you do, I think it's such a more tactile way, maybe, especially with, I'm the kind of person that conversation really helps me understand things. So, maybe I didn't know why everyone's worried about the vaccine being made so quickly. I listened to a podcast about it. I think that's very interesting that some of the stuff that you do, it is explaining some more complicated things,
Mhm.
that maybe, especially if you're not in public health, you might be like, this is a scary topic.
Right, and translating it so that it is easier to understand from a clearer source of information from the literal actual researchers.
For sure. I mean, this is going to be my last question, but I actually wanted to ask you, so you have 3 podcasts. Um, is there like a topic that's coming up or an episode that's coming up you're really excited about, that maybe you want to like just let us know about?
Sure. I'll talk first about the Sisterhood of Limitless Living, um, in honor of API Awareness Month, Heritage Month. We are releasing our next episode with DJ Danga. She is a Filipina. She is in Southern California. She's a DJ, and she shares her story about living with multiple sclerosis and how she has found ways to, she was a dancer, and then multiple sclerosis made that difficult for her. And then she was able to pivot and do new things that she enjoys in her life as a DJ and artist. And so that's a beautiful story that we'll be sharing very soon. And then another episode is through COVID-19. We have Kristen Urquiza. She has been wonderful. She runs Marked by COVID when her father passed away from COVID. She's been, represented, like she was at Biden's debate, and she's been speaking on CNN and things like that. So it's just been wonderful to be able to reach her. And we talk about health disparities in the Latinx community and how the vaccine access has been more limited, and it has very little to do with hesitancy, and there are just so many other factors, and how disproportionately the Latinx community has been so affected by COVID. So those are 2 episodes I'm really excited about.
Oh my gosh, those sound really good. It also makes me think of how like I think some of the best ways to explain diversity and inclusion and the actual like lived experiences of it is just hearing people talk about their experiences and the more like human aspects, instead of this very like tokenizing. That's why I really like, the net with the WOC network and getting to hear all of your guys' stories.
Yeah.
I feel like I have to ask because when we asked you in the pre-interview, is there anything else we should know about you? You said you love podcasts, which I guess should have come as a surprise. What are your favorite types of podcasts, and any shout outs to women of color podcasts? Of course, you can shout out your own if you want.
um, I'll be honest, my favorite podcast is Journey to Launch, and I listen to all her episodes. And she's a woman of color, and I just love hearing all these different stories about financial freedom, and that's so important in, especially particularly in my situation, the autoimmune community, people with disabilities. For me, having to leave a full-time job because it was abusive and stressful and brought forth my first autoimmune relapse and diagnosis. So yeah, Journey to Launch is awesome. And so I love that one as my particular absolute favorite podcast. And to be honest, I think that's really the one that I often listen to. I listen to all of them.
Sounds like you made a podcast buddy. That's what I like to call my favorite podcast hosts that don't know me, but I feel like I really know them. So like as we wrap up, I just wanted to ask, we asked for some advice to, give out to our fellow other podcast network um followers. And when we asked you, you said it's important to focus, when it comes to podcasting, it's important to focus on what you're doing, connect with your podcast interviewees and listeners rather than how others are doing with their podcasts. Do you want to talk a bit more on that? How you came to figuring that out yourself?
Mm-hmm. Yeah, so one thing you'll see often in Facebook groups is people who are like, hey, I just started my podcast last month and I have 20 million downloads. I'm celebrating, woohoo, right? And it just makes you feel like, okay, I'm new. I don't know what I'm doing. And like, I must be doing something wrong because I'm not making 20 million downloads. But then it also depends on the type of podcast. Like, if we're not doing true
Yeah.
crime, it's just harder for whatever reason. True crime is big in our
Yes.
society. And then, it's really just about the journey. It's really about us, doing the podcast and doing it the way that we love to do it. And it's really also like, who you reach, how you reach them, and quality over quantity, I like to say. And just continuing to be consistent and just keeping your eye forward versus comparing or seeing what other people are doing.
It's so hard, but
Otherwise,
that's very
just
important to
learning
keep in
from
mind.
others. Yeah.
For sure, for
So
sure.
I'm
And
happy
was there
with my what are we at now? I think we're at 4,000 downloads. I'm happy.
Yay!
Yeah. And I see Danielle has a couple of questions on here.
Yes, let's I had it. She always has really good questions. Okay. She says, this is a good question. How do you manage your time hosting multiple podcasts and then your life, outside of podcasting as well?
Yeah, it's hard. I struggle. And also just because it's been 2 years, I think it's going to be a process of just learning how to, get used to the schedule and the flow of things. I'm pretty fixed now, I hope, on the set of activities I want to be doing for the next several years. And so, yeah, and there are people out there who do know I struggle with appointments and I struggle trying to get everything together. And it is true, it's human. But I
Yes.
am working on starting to outsource some things. Definitely working on outsourcing my podcast editing for the first time in our second year of Sisterhood of Limitless Living. And then also working with the podcast network, definitely not doing that alone, most definitely. So working with, social media strategists, social media planners, and having a team to do that one for sure.
So all of that stuff can be like a full-on full-time job, especially the editing and social media stuff.
Right, yeah, and I run a nonprofit organization, the
Oh my
Autoimmune
gosh.
Community Institute, which is actually
Oh
going
my
well.
gosh.
It's
Oh
actually very
good.
much it's very much volunteer run at the moment. It's actually doing its thing now, so it's beautiful. All of that is actually going well. It's stable in terms of scheduling, and then my other full-time commitments. So yeah, I'm just trying to be strategic about time and learning how to outsource.
Mm.
this year for the first time, to be honest.
It's when you make that decision, it's like I also had one of my recent podcasts. I also outsourced it. Oh, it was so much easier. I didn't have to
Right?
think about it.
Yeah.
I also didn't have to re-listen to my voice over and over again, which I sometimes don't like doing.
What's your
Um,
podcast about?
mm, I actually have a podcast. It's like I was actually editing it before I started, but I'm gonna release it soon. Uh, I interviewed music artists of color in Canada and talked to them about kind of like their experiences in the Canadian music industry.
I love that. Yeah, I
Yeah.
feel like I need to see more in terms of diversity in Canada. I need to see more.
Yeah, yeah. Well, even hearing your podcast, it makes like especially the first one, the autoimmune one, that makes me so excited because I remember when I was first doing my podcast, just like getting the opportunity to talk to other people with similar experiences as my own, and it felt really good. And I find that that's kind of the best people to make content about those topics are people who are from, they're going to ask the best questions. You're going to ask things that people didn't think of, that other people wouldn't think of. You're going to get feedback from guests being like, I really appreciated you coming at it at that angle. So it's really exciting to hear you're doing quite a bit of that.
Yeah, definitely. I think the power of storytelling is everything. The power of people sharing their experiences firsthand is everything. So even with the COVID podcast, people sharing what's going on around the world. That's what I love about
For
that
sure.
podcast. We've interviewed people in Cuba, in China,
Oh, so
in
cool.
Japan, in Italy, and they've just shared all these different experiences. It was really nice to hear us kind of a picture from the future in a way
Right.
of what we were going to expect 2 months down the line, or whatever it was from Europe,
How did
expecting and
you,
preparing ahead of time that there would be some kind of,
oh, go on. Sorry.
oh yeah, expecting like food challenges and things like that, that supermarkets would get wiped out for a scary moment in time. Those were things that we kind of were preparing for because we heard about
Right.
that in Europe.
Right. And how did you, so for the COVID podcast, you have international guests. How did you reach out to them? How did you think of, how did you get in contact with those guests?
hmm I love Twitter. I use Twitter a lot. Even through Facebook, a few people were like, "Hey, I live in Italy, and this is exactly what's going on right now." So I just reached out, and they were willing to share. And then also on Twitter, in particular, I use Twitter for like science and research Twitter. So people who are, professors of like epidemiology or of infectious disease, people who work with IT, developing systems, just being able to reach them directly and hear that they were interested in speaking to us. So that's how I've been able to do that. One day we'll get Fauci on there. One day.
It'll be maybe like a two-part kind of thing. I hear he's a little less stressed out with the new administration. I just want to remind again people that are just tuning in. This is our every Saturday featuring a lovely member from the Women of Color Podcasting Network. If you want to know more about our community, get involved. You can go to wocpodcasters.co/community. I actually want to ask you this question that Danielle asked at the beginning, which was, what is the hardest part about building this network, your public health podcast network?
I think it's just trying not to get overwhelmed because it's me with one idea, one person, and I have this huge vision for it. So it is scary because I think like, wow, I have to do this right because I'm accountable to every public health professional in the country
Right,
at
right.
this time, right? So I bought the domain for public health podcasters, health equity podcasters, so the Public Health Podcast Network. So those are my domains right now. And so we are the podcast network for public health. We just are. And so I need to make sure I do this right. I want to make sure
Right.
I represent public health correctly and start to build a team in a way that is beneficial for everybody.
Amazing.
So
Oh, I'm so
it's
excited
try
for
not to get
you and the
overwhelmed.
podcast.
Yeah,
I'm
thank
sure you got
you.
this. That sounds like a lot. It sounds like you're doing a good job. As we wrap up, I wanted to know if there was anything else you wanted to plug, any other pieces of useful advice that you wanted to say before I head out.
Okay. Yes, if you're interested in podcasting, the Women of Color Podcast Network is wonderful. I love the new resource, the new website, the new network platform that's being used. I love all the email. I look forward to your emails, all the job postings, and different resources that are out there. So join Women of Color Podcasters.
Oh,
Yes. And then
what
if
about
you,
yourself? What about what you're
sure,
doing?
sure, if you're
Thank you for
interested
that plug, though.
if you're interested in public health, if you're interested in surviving this pandemic and protecting your family and making it and preparing for the next pandemic, even, um, if you just want to learn about public health as a career, even, learn about this public health podcast network through publichealthpodcasters.com. So there is an interest list there if you are a podcaster to become part of our directory. So it's currently an interest list right now. So I am working on kind of like that fee model for what we're going to be doing for memberships and the list. Not expecting it to be very expensive at all, but I am looking at maybe like a 2 or 3 tier model, one for the universities and big organizations who do public health podcasting, and then for the individuals and students. So we're looking at a couple of tier models for membership and the network directory. To learn more about us, again, publichealthpodcasters.com. And there's also an email list there for news and updates.
Perfect. I just made a note to include it in the IGTV version of this recording that we post on a thing, just so that people can, when they're watching it in retrospect, they can actually go and click and make sure. But yeah,
Okay,
that
I'm
wraps
typing
it
it in
up.
right now, probably.
Perfect. Perfect. And then I'm also gonna write that as well. And I guess like before we wrap up, I also wanted to say you have a great podcast voice. I say that to everybody, but you have a lovely podcast voice.
Thank you.
And thank you so much for joining us for our second episode, second IG live of this series. It was really cool to hear your perspective. Very different from some of our other guests. I'm getting to hear so many different parts of the Women of Color Podcast Network. It's making me really excited. So thank you again.
Thanks. I love being here. Really grateful for this opportunity.
Yeah. Well, with that, enjoy the rest of your Saturday and good luck with everything.
You too.
Bye now.
Thank you. Take care.